Hello friends, I'm Dr. PC Gupta, Clinical Director of Vascular and Endovascular Surgery and Interventional Radiology at CARE Hospitals in Hyderabad. I hope you're keeping safe in these difficult times with the corona still around. We've been talking about various vascular problems, and let's talk today about brain stroke or paralysis and the ways to prevent this. Now, to understand what is brain stroke, it is a condition in which poor blood flow to a part of the brain results in cell death, and the cells then do not recover. Death of brain cells will affect any part of the body that is supplied or controlled by that part of the brain. For example, left part of the brain controls the right side of the body and vice versa. Symptoms can be transient when we call it TIA, or it could be more lasting. Now, what are the symptoms of stroke? A person may experience giddiness or dizziness and a sudden tendency to fall. It could be a sudden blackout or loss of vision. It could be paralysis, usually one half of the body or one limb. These are the commonest ones. And it could be speech getting affected in the form of slurring or loss of speech or confusion. There are two types of stroke, ischemic and hemorrhagic. Ischemic stroke is due to lack of blood supply to the brain, which could be due to thrombosis or clotting in the arteries in the brain. Could be due to hypotension in a patient with shock, where the blood flow to the brain is reduced. Could be due to thrombosis of the veins which surround the brain, or could be due to embolism, which means a clot goes up to the brain from one of the larger arteries or from the heart. And the commonest one that we see is a clot going from the carotid artery in the neck to the brain. Hemorrhagic stroke can be due to various reasons, and the bleeding that occurs around the brain or in the brain causes compression of the brain cells and their dysfunction. Can occur due to injury, can occur due to tumors, some abnormal vessels in the brain like AV malformations, or rupture of small arterial aneurysms, especially in patients with hypertension. Ischemic stroke can be due to various arteries getting affected. One we see is the carotid artery in the neck, from where a cholesterol plaque or a clot can embolize to the brain. Then, of course, direct disease of the intracranial small arteries, which is quite common in India. Then large arteries getting affected due to atheroma or cholesterol plaques, and small pieces could embolize to the brain, resulting in stroke. And then, of course, heart or arrhythmia of the heart or irregular beat called atrial fibrillation, where again clots can form and embolize to the brain. Another cause is arterial dissection, where the arterial wall splits, causing blockage of the artery and stroke. Risk factors for like most peripheral vascular diseases and for cardiac disease are quite similar for stroke. Diabetes is a very strong risk factor. The use of tobacco in any form is another important risk factor. Increasing age, alcoholism, junk food or unhealthy diet, and of course hypertension. And hypertension seems to affect women more than men. So for every degree of blood pressure rise, women are more prone to get stroke rather than men. Moving on to how one would be evaluated if one gets stroke and comes to the emergency room. There is a clinical evaluation where a detailed history is taken, a patient is evaluated. A carotid Doppler can be done, which this carotid Doppler shows normal blood flow in the carotid. And here you can see a very thin line of flow in the carotid artery due to plaques or cholesterol plaques in the artery. MRIs can be done, which show these infarcts in the brain, and an angiogram, quite often a CT or MR angiogram, will show a narrowing of the carotid artery due to cholesterol plaque. And this is the one which can be corrected surgically. Severity of stroke can be graded in many ways. The simplest one is the modified Rankin scale, which can be done clinically and depends on the disability. From level 0, where there are no symptoms in a patient who has TIA and recovers completely, to level 5, where there is severe disability, where the patient becomes completely bedridden. Treatment is in the form of course, we modify all the risk factors, whether smoking, hypertension, or diabetes. Specific medications will include antiplatelets, blood thinning medicines like aspirin and clopidogrel, statins or anti-cholesterol medicines, which also have benefit in terms of reducing the arterial disease. If a person comes within the window period of 4.5 hours, clot busters or clot dissolving therapies can be used. If it's a little late, still within 12 hours, and depending on certain criteria, suction thrombectomy can be done, and these procedures will help in early recovery of the patient, and many of the cells which would have died because of stroke, the brain cells can now survive. Many patients will require admission into the ICU for monitoring and intensive care. And once a patient moves out, then rehabilitation in the form of physical therapy is very important to recover from paralysis. Surgery has a definite role in prevention of stroke. Surgery is in the form of carotid endarterectomy, where the cholesterol plaque is removed. When surgery is not feasible, rarely we perform carotid artery stenting. The aim is to prevent stroke. So if a patient has been symptomatic, the aim is to prevent another major stroke. And if a person has been asymptomatic and has a bad plaque, the aim is to prevent stroke. So timely surgery in symptomatic patients, that is within 2 weeks of onset of symptoms, can very significantly reduce the risk of recurrent stroke. If these patients are not operated, the risk of recurrent stroke is much higher. So carotid endarterectomy is often done under local anesthesia, and this is the area of the neck which is anesthetized. And here you can see a schematic representation of the plaque being removed, and then the artery is repaired with a patch, and normal blood flow is restored. In case blood flow to the brain is compromised during surgery, we put a shunt which maintains the blood flow while surgery is being done, and this makes the surgery very safe. These are some plaques, and you can see how dirty looking they are. And these are the bits of cholesterol which break, or blood clots which break off and go to the brain, causing stroke. So it's very important that we remove these in patients where the surgery is required. Preventive measures, back to lifestyle. So a good diet in the form of fresh fruits and vegetables, avoiding junk food, using whole grains, avoiding refined sugars, avoiding refined flours or refined white rice. Exercise for a healthy lifestyle, overall improvement in health, and also to reduce weight. If you're overweight, do not use tobacco. Then medicines we've discussed already, control blood sugar, control blood pressure, and then surgery in the form of endarterectomy, and where endarterectomy cannot be done, carotid artery stenting. In the community, everyone must be familiar with this mnemonic of be fast, so that stroke can be recognized immediately in a patient. So B standing for loss of balance or headache or giddiness. IE stands for eyes, that is loss of vision or blurring of vision. F stands for face or drooping of one side of the mouth. A stands for arms, where there is weakness of arm or legs or both. S stands for speech, where there is difficulty in speaking, loss of speech, slurring of speech, or confusion. This is time to call for an ambulance and shift the patient to the emergency room of a hospital, where emergency treatment for stroke can be provided. And finally, as I said at the beginning of this talk, Corona is still very much around. Please take care, use a mask, use it properly to cover your nose, mouth, and chin when you are in public. Keep your hands clean, wash your hands frequently, or use an alcohol rub. Maintain physical distance from strangers of at least 2 meters. Avoid gathering indoors. Take care, keep yourself safe, keep walking, keep smiling, and I will be back talking about another disease and how to deal with it in terms of prevention and treating. Bye-bye. Take care.